Initial exposure to an allergen. During initial exposure, allergens are processed by macrophages and allergenic epitopes presented to CD4 Th2 cells in the context of class II molecules. In allergic or atopic individuals, T cells secrete interleukin-4, 5, and 13, which promote the rapid isotypic switching and IgE production by plasma cells. Secreted IgE binds specifically to Fc receptors on tissue mast cells and circulating basophils. Second exposure to an allergen. Upon second exposure, the allergen cross-links two cell-bound IgEs, which initiates an energy-dependent mechanism that culminates in a biphasic immune response. The early phase response, which occurs within 20 minutes of exposure, involves IgE antigen interactions and is mediated by preformed pharmacologic mediators. A late phase response, which occurs 4 to 8 hours following exposure, does not involve antibodies and is facilitated by the newly synthesized products of the arachidonic acid pathway. These mediators include prostaglandins, leukotrienes, and platelet activating factor. Late phase reactions occur in some but not all individuals. Systemic anaphylaxis is the most severe form of type 1 hypersensitivity, in which severe bronchoconstriction and hypotension in form of shock may occur. Foods such as peanuts and shellfish may trigger type 1 hypersensitivity, as well as drugs such as penicillins and cephalosporins. One important mediator of type 1 hypersensitivity is histamine. It occurs in granules of tissue mast cells in preformed state. Histamine, when released, causes vasodilation, increased capillary permeability, and smooth muscle contraction. Allergic rhinitis, urticaria, and angioedema may occur. Bronchospasm is so prominent in anaphylaxis due to histamine release. Antihistamine drugs such as loratadine block histamine receptor sites and can be effective in allergic rhinitis management.